My name is Banush Momin, and I'm a health scientist with the Centers for Disease Control and Prevention, the comprehensive cancer control branch within the Division of Cancer Control and Prevention. A cancer of the liver is a disease in which cancer cells form within the tissues of the liver. While there are several types of liver cancer, and this is based on which cells become cancerous, the most common form of liver cancer is what we call hepatocellular carcinoma, or what is widely referred to as HCC. There are secondary liver cancers, and this occurs when the primary cancer occurs outside of the liver, so in another body part, which can spread to the liver or has spread to the liver. Hepatocellular carcinoma is the third leading cause of cancer death worldwide and the ninth leading cause of cancer death in the United States. Now, in the United States, the incidence rate for HCC is highest among certain populations. So the Asian Pacific Islander population, followed by the Black population, then the American Indian Alaskan Native, followed by the whites. Now, it's important to note that the incidence rate is higher for Hispanics than the rate compared to non-Hispanics, as well as 3 times higher for males than females. We're also seeing the large significant increases in HCC incidence rates in specific populations, the white and Black population, as well as this age group of 50 to 59 years. Now, there is a difference in incidence rates based on one's geographic location. So data from a 2010 CDC report show that in the United States, there are 11 states that have had significant increases over the years, with the highest annual percent change reported in 3 states, Georgia, Iowa, and Oklahoma. When we stratify the data by age, the overall incidence rate for hepatocellular carcinoma is 69 years, but when we're looking at the male-female rates, males report an earlier diagnosis age of 62, with females at 69. Additionally, I would say the incidence rate is highest among the 70 to 79 year age bracket. The rate of hepatocellular carcinoma is highest among the Asian Pacific Islander population, primarily because of lack of access to the HPV vaccine. So therefore, this specific population may not have access to the vaccine as many other populations do. The risk factors for hepatocellular carcinoma are well known and include cirrhosis, the hepatitis B and C virus, as well as alcohol consumption, smoking, diabetes, and a more emerging risk factor that we are seeing is obesity. Hepatitis is inflammation of the liver, and I want to say that it is the major risk factor for liver cancer. So globally, they account hepatitis B virus and the hepatitis C virus account for an estimated 78% of global hepatocellular carcinoma cases. The way it's caused by is through contact with blood or the bodily fluid of an infected person. These viruses, hepatitis B virus and hepatitis C virus, induce malignant changes into a cell by affecting a cell's gene expression. What that does is promote and even repress cellular pathways. That prevents a cell from undergoing a form of cell death and can also promote viral replication. That ultimately leads to cirrhosis, which is damage of the liver, and damage of the liver can lead to permanent scarring. And liver cancer almost always occurs after cirrhosis is present. Prevention of cancer can be grouped into primary, secondary, and tertiary. Primary prevention reduces the exposure of a risk factor, in this case, a risk factor for liver cancer. Now, given the list of risk factors that we know for liver cancer, HCC is actually preventable. So for liver cancer, the most successful prevention measure is the vaccination against hepatitis B. This vaccine is available for all age groups, adults and children. There is the more common vaccination schedule is a 3-dose intramuscular injection, but there are approved 2-dose and 4-dose vaccinations as well. Now, vaccination for hepatitis C is unavailable. However, there are forms of primary prevention, and those are targeted primarily at aiming to promote safe injection practices as well as screening of the patient. In addition to these primary prevention measures that I mentioned for the 2 viruses, reducing one's alcohol intake, smoking cessation, as well as managing obesity and diabetes are other ways to prevent liver cancer. Now, as far as secondary, when we think about secondary prevention, we're really thinking about curing an agent that's involved in the formation of a cancer. So in this case, you aren't able to cure an infected individual, a virus-infected individual. Therefore, antiviral drugs are used to help decrease the risk of liver cancer. Now, tertiary prevention includes treatment. So treatment involving chemotherapy drugs as well as antiviral drugs to prevent the recurrence of the cancer. Well, as far as screening, there are several different imaging modalities that are used to diagnose hepatocellular carcinoma. So this includes an ultrasound, an MRI, a CT, and when an abdominal mass of greater than 2 centimeters has been detected, that could lead to very high chance of it being hepatocellular carcinoma. However, further testing is required. So in addition to screening through these imaging modalities, there are other types of chemicals or tumor markers that can detect blood in a patient that could help with diagnosis. In addition, screening should begin at an early age if the patient has been infected in the childhood or perinatal period. However, when determining the need for screening, the prevalence of hepatocellular carcinoma, one's availability of resources, as well as coexisting or risk factors for an individual, including one's family history, would all need to be taken into account to determine the need for screening. If an individual is in a screening program, anywhere between 6 months to a year, they would be screened for the disease. We know that there has been much advancement and improvement in the area of liver cancer prevention and control, but there are continued efforts that are still needed to reverse the trends. And so the areas that are needed, the areas of focus, would primarily be the development of the viral hepatitis services. This would include screening for people that are chronically infected with the virus, the hepatitis B virus, as well as the hepatitis C virus. In addition, implementation of vaccine-based strategies to eliminate the hepatitis B, and in addition, surveillance. So improved public health surveillance is needed.